The Honourable Skame.
Thank you, Mr President. I seek leave to make a brief explanation before addressing a question to the Attorney-General representing the Minister for Health and Wellbeing regarding acute behavioural assessment units.
Leave granted. Leave is granted.
I have met with South Australia's Chief Psychiatrist, who fully endorses the rollout of acute behaviour assessment units attached to hospital emergency departments. I understand he has already relayed this advice to the Minister for Health and Wellbeing. The old way of thinking was to treat a substance abuse issue separate to other mental health issues. This is incorrect. The latest research states that these issues should be treated simultaneously. Assessment units provide care for people under the influence of substances and alcohol when they may otherwise be turned away from an emergency department for being intoxicated. We've come a long way in reducing stigma around certain aspects of mental health, but those who suffer simultaneously from mental health crises and substance abuse still face discrimination, judgment, and often met with low levels of empathy and understanding. Feedback I have had from local advocacy groups say patients who are alcoholic or addicted to substances feel discriminated against by emergency room practices here in South Australia. Melbourne has introduced purpose-built acute behavioural assessment units attached to hospital emergency departments. They've been proven to reduce stigma and fear for those needing to present at hospital while harbouring a substance problem, improve resourcing throughout the emergency department, both within the unit and the extended ED facility, and decrease the use of restrictive interventions such as restraints. These facilities improve safety, reduce stigma, yet currently South Australia has no such facility attached to our hospitals. Local professionals have noted that the Queen Elizabeth Hospital is well placed to facilitate these assessment units. My questions to the Attorney-General representing the Minister are, is the government committed to introducing this important service to South Australian hospitals as recommended by research papers, our Chief Psychiatrist and several other mental health professionals, and when? And what is the government plan to reduce stigma for people suffering substance abuse simultaneously with mental health issues, and especially those that present to our emergency departments?
The honourable member for her question, and will refer those important questions to the Minister in another place and bring back a reply.